you have taken the opportunity to participate tonight. If you are joining us on your laptop or desktop, it's best if you use Chrome as your browser. If you are on your mobile device, you will need to download the Blackboard app to see the slides. For questions this evening, please open your Collaborate panel by using the purple arrow on the lower right-hand part of the screen, and then use the conversation bubble to type in your questions anytime throughout the presentation. We will go through the presentation and answer those questions in the last 10 minutes of the webinar. Please be aware that if anyone can see you typing, it is best not to include any student names or personal information. If you are having trouble hearing the presentation, I will encourage you to use the phone option. Open the session menu with the little lines at the upper left of your screen. Select your phone for audio, and you will be given a phone number and a PIN to use. Okay, on to the presentation. We are privileged tonight to have our presenter, Mrs. Vicki Kohler, Program Director for Project Aware. Mrs. Kohler, it's all yours, and we look forward to this exciting presentation.
Thank you, Dr. Brim. Good evening, everybody, and thank you so much for joining us. Before I get started, I'd just like to say that I am so honored and happy to be here, especially on this week talking about this topic, because nationally this is Mental Illness Awareness Week. So how fortunate we are that we can address this important topic. To give a little bit of background, I am a school social worker and have been a Pinellas County school social worker for almost 18 years, um, and currently have been in the position overseeing the Project Aware grant for the last 3 years. The Project Aware grant began as a response to the tragedy that occurred in Sandy Hook at Sandy Hook Elementary. There was funding provided by the federal government through the Substance Abuse and Mental Health Administration to provide a response and encourage resiliency. AWARE stands for awareness, um, uh, advancing wellness and resiliency in education. The three overarching goals for Project Aware is to have increased youth access to mental health services and supports within a data-based multi-tiered framework. And what that means is that we want to encourage that students are identified early, that families receive the support that they need. Um, we are looking to increase awareness of mental health issues within our youth, um, within their families, the school and communities, and then also increasing the implementation of evidence-based, culturally responsive mental health practices. We were working really hard towards utilizing interventions and programs that have been known to work and that have been researched. So for today, some of our objectives of this time together is that we will talk about some common mental health disorders, some facts about mental health. We'll talk about typical development, and we'll also talk about how to help, how to get help, um, and how to access resources. Now, the next slide that you see here is a nice visual of what we would like to really encourage and promote, which is a complete youth mental health perspective. In other words, there is a continuum. There is both illness and there is wellness. And for so long, a lot of the focus is on negative indicators, in other words, trying to find the problem. And so, our hope is that by increasing mental health awareness, we can also increase the knowledge of mental wellness. And by that, we hope to encourage life practices that not only our students learn at a young age, but that our families can also incorporate to be more mentally healthy. If you see on the continuum on the slide, it shows that there are negative indicators in mental health, but that there's also many things that we can build into our everyday lives that will encourage well being and encourage healthy mental status. And much like you find that um, society now has focused on physical health and things such as heart health and cancer prevention and diabetes prevention, we're encouraged to eat healthy diets, we're encouraged to exercise, all of these things to help with our physical health. They do as well impact our mental health. And then, along with that, also learning to practice some things that will make us healthy. So we'll start with just an overall definition on what is a mental health disorder. So for tonight, we are defining mental health disorder or mental illness as a diagnosable illness, and we'll talk a little bit more later about who diagnoses that. Um, and it's a diagnosable illness that affects a person's thinking, their emotional state, and their behavior. Um, Typically, a mental health disorder or mental illness, when out of control, can disrupt a person's ability to work or attend school, to carry out their daily activities, as well as engage in satisfying relationships. When a mental health disorder disrupts a person's ability in all of these three areas, it is important that that person receives support, and so we'll talk about that in more in depth at a later slide. So, what are some of the disorders that we might hear about? Well, in the school arena, so we're talking about youth, and so many of the disorders that you may hear of or that you may be familiar with are things like ADD, ADHD, that those stand for attention deficit hyperactivity disorder. ADD is without. ODD is oppositional defiance disorder, and OCD is obsessive compulsive disorder. Some of the other diagnoses you may hear of are anxiety, bipolar, depression, eating disorders, and substance use disorders. These are all disorders that we may see in youth, particularly adolescent youth, within the school age. Now, the percentage of youth who meet criteria for a mental health diagnosis, I like to show this slide because often what we hear a lot about, particularly from the school setting, are students who may have been identified as having attention deficit hyperactivity disorder. But there are a large group of students who also are dealing with anxiety. And if you notice, on this slide, anxiety is at 31.9% for youth who meet criteria for this diagnosis. And so that's almost 32% of our youth that struggle with anxiety. Next would be behavior disorders, mood disorders, and then substance use disorders. So some of the facts that I collected for all of you, just to have an idea of what mental health facts we have in schools, is that 1 in 6 school age youth experience impairments in life functioning due to mental illness. But other statistics show us that 1 in 5 adults experience impairments in life functioning, and 1 in 4 youth are affected somehow in their lives by mental illness. Those are prevalent statistics and show the need for early intervention. The most prevalent, as I discussed before, and most commonly heard would be attention deficit hyperactivity disorder, behavioral conduct problems, anxiety, and depression. These are probably the most pervasive and the ones that we would see the most in our school age students. Definitely not the only ones, but they would be the most common. Now, half of mental illnesses emerge during or before adolescence. It is very common to see an onset of symptoms during and between the ages of about 13 to 18. But fewer than half of those students with mental illness receive adequate treatment. And some of this has to do with stigma and not having access to care and not having access to early intervention. Some more facts to see are that suicide is known as the second leading cause of death for ages 10 to 24, only um, above, or excuse me, below accidents. Um, Suicide is becoming a very prevalent problem throughout our society, and in youth, it is the second leading cause. LGBTQ teens are 6 times more likely to experience symptoms of depression than the general population. And the earlier that things are addressed, the more likely the young person is to avoid an onset or a progression of a mental illness. And so we're going to talk a little bit about perhaps some characteristics, um, physical, emotional, behavioral, and such that may come up as um, some signs and symptoms and some things to look out for. Now, I want to caution that we don't want to look at these characteristics of mental health disorders in isolation. There's definitely, you're going to see that there's some fine lines in that some of these physical characteristics could be something different. The same as for some of the others. And so, whenever you're seeing some of these signs, you also want to include your physician, you want to include your family to discuss some of the things that you're seeing. So, you never want to look at these things in isolation. But some characteristics that you might see physically occurring would be things like rapid heart rate, chest pain, for some, stomach pain, nausea, appearance, it affects it, the hygiene is affected, and sometimes there's weight gain or loss. Now, if you notice, some of these symptoms could be many things. It could be a virus. It could be a heart attack. It could be many other physical ailments. Um, One of the things to keep in mind is that when it comes to physical symptoms, you always want to refer to a physician to ensure there is nothing else physically going on before you automatically assume that it is an emotional or mental health issue. Um, Now, that said, some of these characteristics could also be seen in youth that are experiencing anxiety or depression. Some emotional characteristics that might be seen in youth that may be presenting with a mental health disorder would be a depressed mood, excessive irritability, excessive anxiety or guilt, lack of inhibition or lack of emotion, and primarily in depression, you would see helplessness or hopelessness. If we see some of these characteristics, they can be an indicator or a symptom that something more is going on. And so it is important to have conversations and point out observations when you do have concerns. Some other characteristics that might be seen behaviorally would be crying spells or the inability to stop crying, withdrawing from others, losing motivation to do anything, changes in their energy level, and that could be both either excessive energy or no energy at all. Their neglect of their responsibilities, not only things that they are responsible for example, like schoolwork and even extracurricular activities, but also neglect of responsibilities like taking care of themselves, taking care of their eating, taking care of their hygiene. And risk taking would be another behavioral characteristic that may warrant some more probing. Now, thoughts, as far as thought characteristics that you may see in a youth that could be presenting with a mental health um, disorder, issue, crisis, would be a self criticism or self blame, kind of that inability of that youth to see the positive within themselves. Very pessimistic, um, kind of that self criticism and pessimism, kind of like you would see in Eeyore, you know, that Winnie the Pooh character that he exemplifies that mood, that depressive mood type of personality. Um, they may have some difficulty concentrating, difficulty with getting their schoolwork done, complaining that they have racing thoughts, that they can't seem to organize their thoughts, and thus having some indecisiveness or confusion. Now, again, all of these warning signs looked at in isolation could be attributed to some other factors, but they together, looking at the whole picture of what's going on with the student and having conversation with the student, these are all things that could be some things to see. Now, some warning signs that we might see in an average adolescent that would warrant perhaps either a visit to a physician or discussion with a mental health professional are drastic changes in behavior, whether that's with their personality, their eating, or their sleeping habits. So important that they have a healthy diet, that they have a healthy sleep pattern. And when we're seeing that this is impacting their living, um, that is definitely a warning sign that you want to stay on top of. Um, Having unrealistic or overwhelming fear, exhibiting a worry that impacts their daily activities, that keeps them from, let's say, being involved or completing their schoolwork. Um, these are things that we would want to pay attention to. Um, Another warning sign, and a very serious warning sign that we should never take lightly, are threats to harm themselves or others. Um, this definitely warrants getting more professional help if there are any concerns or if the student is discussing any threats of harming themselves or others. Some other warning signs that you might see is that they're feeling sad for 2 weeks or longer. Maybe they're out of control or taking risk taking behaviors, or involved in risk taking behaviors. Um, these things can also be a sign, a warning sign that something more is going on and some more support or help would be beneficial to attain for the student or the youth. So I like this slide because it really illustrates a little bit and pulls together some of what we've just been talking about. So an average teen would probably um, show that they prefer to spend time with their friends and pull away from their family. But a teen who may be exhibiting a warning sign may be spending more time alone and doesn't want anybody around. There's a bit more difference in that type of withdrawing. The average teen might really demand more privacy, and they demand it more often. But the teen that is exhibiting a warning sign might seem to be like they're hiding something or being secretive. An average teen they may move from childhood interests and set those aside and then exchange them for more teen like activities. That is a typical average teen behavior. But a warning sign would be if they completely remove themselves from all activities that they enjoy. They set those aside and they really don't replace them with anything else. They withdraw not only from people but also from the things that brought them joy. Now, some risk factors that we may see that affect um, of youth mental health would be stressful events, any trauma that they may have experienced, if they have a chemical imbalance, if they're using substances. Any some We don't see this as much here in Florida because we are the Sunshine State, but seasonal changes can also affect whether or not a youth is a little bit more susceptible um, to a mental health issue. Um, Typically, when we talk about seasonal changes, it's the winter months when there's not a lot of sunshine, but and that's in the northern areas. But certainly, I'm sure that there are some other things that may affect here, such as the not receiving excessive vitamin D, because we here in the Sunshine State use a lot of um, sunscreen. And so, even those simple things could also affect a person's physical makeup and mental health. Um, some other risk factors are things like ongoing stress, whether they have been diagnosed or have a chronic medical condition, or if it's a life threatening medical condition. All of these risk factors add more stress, and if they are already struggling and showing some of the characteristics that we just talked about, again, not looking at it individually, if this is added to it, it may warrant looking further into getting that youth support. The good news is that we can all affect um, mental wellness. I just talked a lot about some signs and symptoms and characteristics of mental illness, but we also know that with early intervention, there is the ability for a youth to recover and to be well. And one of the things that supports this are protective factors. So, protective factors are things that you see here listed, like regular school attendance and academic performance, having a good social support system or a good network, um, having community bonding and good family and parental support. One of the most important protective factors that has been researched that has been found in youth is at least one close relationship with at least one adult. Um, Ultimately, this has been seen over and over again as a very influential protective factor. Also, being involved in organized sports, but in addition to organized sports, any other organized activities, whether it's involving music or um, other arts that would support the growth for our youth. Some protective factors that we had not mentioned yet are like having a high self-esteem. We talked about healthy practices earlier, like eating and sleeping well, having good problem-solving skills, their spirituality, and having some of their faith. Um, is another protective factor, as well as avoiding substances and a consistent home and family routine. These are all things that can support a youth whenever they're going through a crisis or are going through a difficult time in their life, whether it's a one-time acute traumatic experience or over time something that they're going through. These are protective factors have been known to be helpful in supporting recovery and supporting mental wellness. And that said, the good message is that most youth do pass through adolescence with relatively little difficulty despite all of these challenges. Our youth are resilient, and with support, with early identification, with having significant relationships with adults, all of these things can help a youth go through adolescence with relatively little difficulty. And knowing that just because a youth has a mental health challenge, um, it does not mean that they will struggle forever, that they can find wellness. Um, so now that we've talked about some characteristics and we've talked about the risk factors and what are things that can protect our youth, let's talk a little bit about who can diagnose a mental health disorder. So typically, those that you see listed on the slide: psychiatrists, psychologists, physicians, physician's assistant, nurse practitioners, licensed clinical social workers, and licensed mental health counselors can all diagnose a mental health disorder. They can also be providers to support the youth and the family if a mental health disorder has been identified. Now, in the schools, the professional that can provide help, or the mental health professional that can provide help, are listed here as the school counselor, the school social worker, the school psychologist, and the school nurse. Here in Pinellas County Schools, we benefit from a very strong student services department, so that every school has an assigned counselor, social worker, psychologist, and nurse. So they are hands-on and on-campus professionals that can provide assistance to our youth. Now, who can provide professional help? So, aside from those that were just mentioned, the medical personnel that were just mentioned, there are also people in the community that can provide professional help. And that includes counselors, psychologists. Again, we have our physicians and psychiatrists, but in addition, there are support groups and community mental health agencies that can offer services and provide professional help to our youth who are struggling. Some examples of those community agencies: this is not um, an exhaustive list. There are certainly many, but these are just an example of some of the community agencies you may have already heard of, but that can also provide support. So 211, Suncoast Center for Community Mental Health, Directions for Living, all those listed on this slide are agencies that we have within Pinellas County, in addition to private practitioners that can offer support if we have a mental health concern for one of our youth. Now, once a person seeks assistance from one of these professionals, some of the types of treatment that you might find um, would be individual, family, or group counseling through support groups. Sometimes you find peer counseling. Um, there are case management services that can assist in navigating um, when there is more than one agency involved. And then some other things that are helpful or treatment that might be suggested by a professional are biofeedback, specific treatments such as alcohol and drug treatment, or a more restrictive environment, which would be a residential treatment. Some facts about treatment: well, all mental health disorders are treatable. That's good news. Although an individual receives treatment, it does not mean that they will always be in treatment. And even those who are resistant to treatment may see some improvement. The majority of youth will only need outpatient care, which means that they would be seen at an agency outside of a hospital setting or a residential setting. They can be seen perhaps once or twice a week at an office. Some things links that we have found through research between mental health and school is that students um, who experience mental wellness earn better grades, their attendance is better, they perform better on standardized tests, they have a positive attitude towards learning, and they have better relationships. So when mental wellness is present, all of these other things benefit from mental wellness. So, what can I do to support until help arrives? In other words, what can someone do until to support someone until help arrives? Well, if a student is exhibiting some of the characteristics that we talked about, or have experienced some of the risk factors that we discussed, offer to listen to them, listen to their story, listen using and respond using I statements. Validate their feelings. Sometimes it's very difficult for youth to share what they're feeling, and it's important that they are validated, that they realize that for many youth, what's going on with them at the moment may, for adults, may not seem very important, but may seem like it's a huge impact for that youth, and we need to be able to validate their feelings. Um, it's also important that we promote self advocacy, help giving them the words and the tools that they need to express themselves and to advocate for themselves and their needs. Um, and the other thing that we can all do is refer to professional support when we see that um, the um, help is not that the support is not working and that they may need a higher level of support. So something I did want to talk about and offer as a resource for those who are listening is youth mental health first aid. A lot of what we just talked about, I just briefly touched on and gave some information and facts. But if you want to dig a little deeper, if you want to feel more prepared, there is a course called Youth Mental Health First Aid. We really want to see that youth mental health first aid is for mental health, just as first aid has been for CPR. In other words, it prepares any layperson, any person who has a youth in their life or who is present in a youth's life to see signs and symptoms and know what to do. And so this course is a nationally certified course. It is an 8 hour course, and it helps people to learn about typical adolescent development, learn a little bit more about signs and symptoms and diagnoses, and it also encourages to use an action plan. The 5-step action plan that people learn, or I should say participants learn when they attend this training, help in a variety of situations, anywhere from someone who may be exhibiting a panic attack, someone who may be verbalizing thoughts of suicide, or also someone who's going through an acute crisis, whether it's the loss of a loved one or divorce or um, natural disaster has happened in their environment. So the skills that you learn are applicable across all of the roles that you provide, from parent to employee to coach. Um, and it it definitely is a useful tool to have to provide assistance. Now, if you want more information about scheduling a course or attending one, you're welcome to contact me. My contact information is on the slide. I organize and manage the trainings for Pinellas County Schools. And I'm happy to say that we are supporting and training not only our school staff but our community as well. Since the grant has started, we've trained probably over 1,800 participants, and it is growing. Um, it is also a nationwide movement, so that is also comforting to know that it is throughout the state and the nation. And that would conclude our time together. Does anyone have any questions?
This is the opportunity to answer some questions. I do see there is a hand for Thelma. I'm waiting to see if I see your question. I don't know, Vicki, if you could see Thelma's question.
I see her hand is up. I don't see a question though.
If you can
Um,
please type your question in the bubble below. Um, but in the interim, waiting on Thelma's question, I do see, because I had asked a question about the process for instructional staff, if they observe threshold behaviors for, noted for mental illness. And thank you, Vanessa, for adding your input, but I didn't know if Vicki, you wanted to add any more information to that.
let me see. Yes, if professional, if our school staff, our instructional staff, or our support staff, so other staff such as our bus drivers, our cafeteria workers, all of those that encompass our support staff, if they see any observable behaviors, they are encouraged. I would encourage that you have conversation with someone from your student services personnel at the school. These are staff members that know your community, they know your campus, and are the mental health professionals that are available. And that would be a start. You can certainly have a conversation with the social worker, psychologist, school counselor, or nurse about the behaviors that you are observing, um, and then together come up with next steps.
Okay, are there any more questions? Thelma, I do apologize because I do not see your question, but you can always email Mrs. Kohler or myself. When you receive the recording, which should come out tomorrow, there will be information on the recording and in the email so that you can contact us directly if you have any additional questions. So at this time, that since I don't see Ms. Kohler, I want to thank you for a very thorough job. I learned a lot as a moderator, and I'm hoping that our parents have increased in their knowledge as well. So thank you very much, and have a wonderful evening.
Thank you, Dr. Brennan. That was my pleasure.